The following program contains mature subject matter. Viewer discretion is advised.
We talk about, for mild prolapse, we talk about like Kegel exercises or pelvic floor physical therapy. Sometimes we can do a pessary, which is putting a device into the vagina to help push things back into place. But sometimes a surgery is warranted, especially when it's this severe. So can you tell us a little bit about her particular procedure?
Sure. So this is a view of the normal pelvic anatomy in a female. You see in the top of the vagina, the cervix comes in, and that's the structure that dilates when a woman has a baby. In front of that is the bladder, and behind it is the rectum. Normally, the vaginal canal should be 4 to 5 inches long. There should be good support to keep the bladder in place and good support to keep the rectum in place. In Anita's case, this uterus was completely outside of the body here. And as it came down, it pulled the bladder, so the bladder is now out here, and the rectum is out here. And literally everything is sort of turned inside out. We started off by removing the uterus. Although the uterus was not abnormal, it was completely prolapsed. So the hysterectomy was done to get the uterus out of the way, and then we did a complete reconstruction of the vagina, tacked the top of the vagina far up inside the pelvis, created support underneath the bladder, created support in front of the rectum, narrowed down the vaginal introitus. Our goal is to correct the anatomy, but also maintain and restore function.
Yeah.
So that's bladder function, bowel function, as well as sexual function.
Wow.
Well, Anita, he fixed you up physically,
Yes.
right?
Yes, he did.
How did this change you emotionally?
Yeah, my emotions were, it was, because it was outside, it was peeling, it was causing me a difficulty to walk. It affected so much.
And
My intimacy with my husband,
That was an
10
issue.
years gone.
10 years. Well,
10 years gone.
Well, what about now? Tell us about your daily life now and your,
Well,
I mean, you can give us just a really general summary around the whole husband thing, but
wait a
yeah,
minute,
tell
I
us.
gotta get an okay first. Am I okay to go back to my everyday and the intimacy?
Yeah, so I saw Anita yesterday. She's 8 weeks post-op, doing fabulous. And you have to hopefully obtain long-term durability with the repair, you have to give time to let the sutures and the tissue scar into place, and they've scarred in very nicely. So I am formally releasing you of all your restrictions.
Uh-oh.
She has
Congratulations.
I tell you what, all the women in the audience are very excited for you, but I want to hear from you. How will it feel to be able to be intimate with your husband again?
I'll have to learn all over again.
Well, that's not a bad thing.
But yeah, I was afraid of him, just a hug, because one thing would lead to the other. So now,
Well, good for you.
it all takes
now-
place.
Anita,
It all takes
Anita,
place.
one last question. You've been through so much successfully, happy now, you just got the green light, life is good. What advice do you have? Because we just said so many women are experiencing similar problems. They're afraid, they're embarrassed, but yet at the same time they're suffering. What is your message?
Don't be afraid. Don't be afraid. That's where I was, and the screen. But when they told me that I wasn't the only one, you have nothing to be afraid of. And the sooner, the better.
Anita, you're
Thank
great.
you. Thank you.
No, excuse me. Thank you. Thank my granddaughter that sent the letter. Thank God above. And thank you, Doctor.
Thank you for sharing your story.
Anita, we know that your medical condition, kept you at home for a long time, but I think we all agree it's time to live life once again, right? Well, we're sending you on a little road trip. You and your husband are going to the Sofitel Hotel here in Los Angeles, in Beverly Hills, for 2 nights to relax, enjoy romantic meals and pampering at Le Salon.
Are you blushing?
What do you think about that, Anita?
Oh, he's going to be happy.
Everybody's going to be happy. Anita, thank you so much
Thank
for
you.
sharing. And Dr. Karram, thank you.
Yes.
We're blessed that we have doctors like you that can
Yes,
fix this,
thank you.
this type of problem. Continued success.